Hello, everyone. This is Michelle, the Childcare Entrepreneur, and this is our news update, latest news on some of the issues that are centered around childcare and education. So, I have been looking at a few articles that deal with childcare staffing, and it is a huge concern for a lot of parents. It's a huge concern for a lot of the childcare centers, as well as the family childcare settings. And what I'm finding is that either there is a shortage of staff so that centers cannot open that particular classroom or area. And so they're putting parents on waiting lists because of that, or some are not accepting in the family child care settings. They're not accepting, let's say, like for New Jersey, it's 5 children. They may be accepting a little bit less than that, or they may be operating at different times of the day or different days of the week. So there's a lot of different dynamics going on. And what I find when I read um, a lot of these articles is that there is a shortage not only in staff, but the pay is not what um, a lot of staff are looking for, or not just the pay, but the short-term solutions are okay for right now, but there needs to be more long-term solutions. So one of the things that really worked well um, during lockdown and while essential workers were working with childcare is the implementation of subsidized payments being based on enrollment. And so that was a really good thing for a lot of the centers, a lot of the family childcare providers. And so that is something that is continuing to be looked at. And also, I keep hearing the word long term. So we're going to read this article about what's going on in terms of the staff shortage and maybe some solutions that this article will bring out in this New Jersey .com news here. So the article called Childcare Staffing Shortage Threatens to Stall New Jersey's Recovery and Parents' Plans to Return to Work. And this was recent as in August 9th, 2021. All right, so for 17 years, Keisha Wright Daniel never had a problem finding teachers. But in February, she had an open teaching job at the child care center she owns and operates in Pennsauken, New Jersey, and no one to fill it. So she turned to the typical avenues, job websites, word of mouth, the center's Facebook page. No one was responding, said Wright Daniel, the director of care for Me Children's Learning Center. Childcare providers across the state are facing a dire staffing shortage exacerbated by the pandemic that could potentially derail the state's recovery as offices continue to reopen and parents and children prepare for a full-time in-person school year in September, experts say. Multiple vacancies, empty classrooms without teachers, decreased hours, and long wait lists for available spots, which is what I mentioned in the beginning. The conditions afflicting childcare centers throughout the state will have a far-reaching impact on working parents, employers, and all residents unless sweeping action is taken, industry experts say. Although compensation was bad before the pandemic, many childcare workers, similar to the minimum wage workers in restaurants and public works, are choosing to leave the industry for steadier and higher paying work, as the pandemic has prompted a labor reckoning for countless people. Industry leaders are calling for a dramatic reimagining of the caregiving sector, including greater public funding and lasting policy solutions that transform the industry, but worry their concerns are not being seriously considered. Caregiving primarily falls on women's shoulders, and the pandemic has already disproportionately impacted their employment. Nearly 2 million American women left the workforce entirely during the pandemic, largely because schools and daycares shut down. Childcare centers are also mostly staffed by women, primarily women of color. Now, childcare, an issue long overlooked by policymakers, could hold the state and nation back from a full economic recovery after the coronavirus pandemic. More than 7.5 million adults are still not working because they're caring for children not in school or daycare, according to a June 2021 household pulse survey from the US Census Bureau. In New Jersey, childcare providers are seeing the same staffing shortage and its ramifications that are playing out across the country. Wright Daniel ended up hiring a parent in June whose child attends the center in Camden County and wanted a career switch, but her difficulty in finding another teacher underscores the industry's vulnerability. As directors struggle to staff their centers, some are forced to decrease their operating hours and the number of available spots for children. With fewer spots and hours, industries that depend on reliable childcare, like K-12 teachers, healthcare workers, and people in other sectors, may see a ripple effect with their own employees this fall as schools and other offices reopen. The current childcare staffing crisis is the biggest crisis I've seen in my 20-year tenure in the industry, said Megan Taramina, who represents about 2,000 center-based and family childcare providers as the president of the New Jersey Association for the Education of Young Children. When you take a business model that is set up to operate on such razor-thin budgets and then you shift anything, you're going to see a crisis, she said. The pandemic shifted budget lines straight across the page. Staffing shortage. There are plenty of reasons childcare centers are short-staffed. The wages are low, and people can find better pay and benefits at large retailers like Costco and Target, experts say. Many centers were already struggling to match minimum wage, which will continue to rise over the next few years. It's currently $12 an hour in New Jersey, but will increase to $15 an hour for most workers in 2024. Wright Daniels teachers' pay starts at $12.25 and goes up to $13.25. It's what she can afford to pay right now, but it's definitely not enough, she said in an interview. The teacher should be making a whole lot more. Many independently owned centers also lack professional benefits because they can't afford it, including paid vacation time, health benefits, and retirement packages, said Taramina, who was also the executive director of the Learning Path in Chatham. Childcare compensation was always poor, experts say, but the pandemic is fueling an increased labor shortage due to pay. Some workers are retiring early, while others are transitioning into other sectors like retail or adjacent jobs like public education. If a qualified accredited teacher wants to remain in early education but wants better pay, they can shift into preschool or kindergarten. The median wage of a childcare worker in New Jersey is $12.25, but it goes up to $17.36 for a preschool teacher, according to 2019 data from the Center for the Study of Childcare Employment at the University of California, Berkeley. The poverty rate for early educators in the state is 14.1%, which is 7.7 times as high for K-8 teachers at 1.8%, according to the center's data. Marcia, a 66-year-old in Essex County, recently left her job at a center because of the lack of benefits. After spending 16 years in the childcare industry, she's starting a new job at a senior assisted living facility. As she gets older, she says she's prioritizing her retirement for when the time comes. Marcia, who asked for her last name to be withheld for privacy concerns, previously made $14 an hour at the childcare center. Now she will be making $16 an hour plus benefits. I knew at my job that I would not be getting any benefits because I know they can't afford to, but I love the kids and that's why I really stayed, she said. But I'm getting up in age now and I need something if I have to retire, and when. Not all jobs have returned to the industry either. 1 in 8 childcare jobs remains lost since the pandemic start, according to a June 2021 analysis from the National Women's Law Center. When centers are short on staff, they must find ways to adapt. Winifred Smith Jenkins, the senior director of 3 family-owned childcare centers in Summit and East Orange, estimates 40% of classroom staff positions remain unfilled at one of her East Orange locations. As a result, Smith Jenkins said she has empty classrooms without teachers, a wait list of parents looking to secure a spot, and decreased operational hours. Before the pandemic, the Summit location was open from 7 a.m. to 7 p.m. Now it opens an hour later in the morning and closes an hour and a half earlier because she doesn't have enough staff to keep it open without providing overtime pay. Employers place pressure on parents to figure out adequate childcare, Smith Jenkins said, and parents in turn place pressure on center workers who place pressure on themselves. And it is a bubble that could end up bursting, she said. Increased costs. As center workers face increased financial difficulties, so do parents. In New Jersey, the average annual cost of infant care is $12,988, according to data from the Economic Policy Institute. Childcare is deemed affordable if it costs no more than 7% of a family's income, according to the federal government. But infant care for one child takes up to 14.6% of a median family's income in the state. Louise Kakula, a 27-year-old single mom, knows the high cost of childcare well. She struggled to find an affordable option over the summer for her 4-year-old son, Malcolm. She moved to Princeton from Trenton a couple of years ago to raise him. But between rent, car payments, and tuition costs, she's earning a master's degree in counseling while working full-time. Kakula had difficulty affording childcare. One nearby center that offered unique programs like robotics was 75% covered by a state subsidy, but at $120 a week, plus an initial registration fee. Kakula couldn't afford it at her roughly $40,000 salary. Right now, I genuinely feel like I'm living from check to check, she said. Kakula eventually found a day school in Lawrenceville that accepted her son and allowed her to pay a reduced rate of $180 for the month. She hopes to find a higher paying job when she graduates with her master's, so childcare costs are no longer a financial strain. It's just like, while I'm doing this, I need a little bit of help, she said, of the center she couldn't afford. I know I need to pay something, but what you're asking me to pay, I can't afford it. Childcare is incredibly expensive due to a combination of high labor costs dictated by high staff to child ratios, strict state regulations, and other necessary expenses like rent and utilities, experts say. Unlike other industries, the price of goods can't be increased to match wages. Centers that accept state subsidies receive a certain percentage of tuition, while centers that solely operate on parent pay are unable to raise their tuition too much out of fears they'll price people out. There are also square footage requirements, licensure requirements, and health requirements. I think there is this false thought that childcare always makes it work and we always just kind of get there, Tavermina said. But I don't think that people understand how many providers are teetering on the fence right now as to whether they're going to survive this next couple months. How to fix it? Advocates say there's a fix. Fund childcare like a public good, similar to K-12 education. Not every family has the luxury of relatives close by that can help out, and we need the childcare system as an integral part of our economic recovery, said Cynthia Rice, a senior policy analyst at Advocates for Children of New Jersey. State officials have expressed support for focusing on childcare as a crucial part of helping women return to the workforce. It's been a priority in this administration, and we're going to need to continue focusing and directing resources to the care industry, State Treasurer Elizabeth Moyo sorry about that name there, said of caregiving in a June interview. But advocates say steps taken so far are only half measures that won't solve the deeper issues if they don't focus on long-term solutions that prioritize lasting change. So there's that word long-term, which is definitely needed. In New Jersey alone, more than 225,000 adults are not working because they're caring for children not in school or daycare, according to the June Household Pulse survey from the US Census Bureau. Some money is being poured into the system from both federal and state funds. The state will receive $694 million in child care relief funds through the American Rescue Plan's Child Care Stabilization and Development Funds, a coronavirus stimulus package signed into law by President Joe Biden in March. Governor Phil Murphy also recently signed a bill appropriating an additional $100 million in child care funds, which is coming from the ARP's State Fiscal Recovery Fund, which awarded New Jersey a total of $6.2 billion. But none of the money has been distributed yet, according to Tom Hester, a spokesman at the Department of Human Services. The department is working with the federal treasury to ensure the program complies with federal guidelines, he said, but declined to provide a timeline of when funds will be released. And that's the thing. This is what a lot of the childcare industry is waiting for, to see how this money is going to be distributed. That is the huge, huge question from this stabilization money that's coming. So another bill designed to help the industry, A4746, has passed both houses and is awaiting Murphy's signature. The bill will require certain subsidy payments for childcare centers be based on enrollment instead of attendance. A spokeswoman for Murphy's declined to comment on pending legislation. So that's another thing as well. The payments, the subsidy payments based on enrollment worked quite well um, during the pandemic, the lockdowns and things like that, that it was one of the things that a lot of childcare providers were proposing to be put into a long-term plan for future payments in childcare. So we'll see about that as well. When centers were forced to close in March 2020, the state's Department of Health and Human Services, which controls the subsidies, changed the payments from attendance to enrollment, allowing centers to still collect the subsidy funds they would typically receive. The bill would make the change permanent, providing a more consistent stream of revenue for some centers. So that is the key too, consistency and long term. Advocates and childcare providers in New Jersey commended the state for the incoming funding, but emphasized the current climate's opportunity to structurally change the industry to better support the workforce. Potential tangible solutions include increasing workforce compensation, creating job packages that professionalize both the work and the industry, and implementing policies to lift early education as an industry, Tavermina said. We're anxiously waiting and hoping we are innovative enough to make radical changes that will change the system for the better in the long run, she said, not just in the moment. So this was a really good article that really talked about a lot of the things that concern childcare providers and the childcare industry. And a few of the things that uh, we have been talking about in our private conversations, in our association meetings and webinars and things like that, is that the subsidy, for the subsidy payments for the tuition on both parts, centers, family childcare providers, will continue as a part of enrollment, um, which the article states did very, very well. I also like the fact that this article talks about childcare that, let me find it here. Um, um, see changes. It talks about actually professionalizing this industry, which is also a big part of childcare. So potential tangible solutions include increasing workforce compensation. That is what childcare has been asking for many years. Creating job packages that professionalize both the work and the industry. Um, and that really would make a difference. So that means that we would be seen as a viable part of society, right? That means that we are seen as professionals. So we've gone from not really uh, having a voice, so to speak, in the industry to being essential now, right? During the lockdown and pandemic, and we need to move into professionalizing both the work of the childcare provider and the industry as the and child care. So that is very important in implementing policies to lift early education as an industry. So that is very important. And a lot of what is being discussed is that, um, you know, having early childhood degrees would be a plus. Um, Now that parents and now that policymakers are seeing that childcare is viable in communities, that, we make them a part of the discussion of long-term um, long-term policy discussions and as well as nationally. So this is not just a concern for New Jersey. And I read you an article for New Jersey. This is where I happen to live, and I thought it was interesting what is going on in terms of the stabilization grant as well as what's going on with our um, government in New Jersey with Governor Murphy. So some of these things either just need to be signed into, um, so we can start distributing this money, or really needs to be looked at long term, as the article stated, and not just a short term fix for something that probably will come up again, not because of a pandemic, but just because it is necessary and needed before the pandemic. So uh, hope this article really helped to clarify some of the things that are needed in New Jersey, but not just in New Jersey, but this is happening everywhere, and it is happening in a lot of different industries. Um, so a lot of the articles I've read were in other states as well, and everybody is trying to figure out what they're going to do. But the key word that I read in all the articles was that something needs to be done long term. And so we wait for what is going to happen. And I know that our voices were heard on associations that I belong to. Uh, we were bringing up testimony on these things, and people were really um, expressing their feelings, expressing their ideas and their concerns. And I believe that we were heard. So we will tune in to see what is going to happen. So until the next time, take care. Make sure you subscribe, like, put your comments down below. I'd love to hear your ideas and your thoughts on some of these issues that we are bringing up. Alrighty, till next time with the Childcare Entrepreneur News Updates.